Hi guys, my name is Milan Collins and I will be presenting congestive heart failure for the nurse case management presentation for NURS442, nursing case management of vulnerable patients. So the patient profile is Mr. JC. He's a 68-year-old African-American tall male. He's married with 2 grown children. He lives with his wife and his children do live close by to him, so he has a pretty good support system. Socioeconomic status. He was a formal math teacher at a local high school, but was recently laid off, forcing him to lose his health insurance. Therefore, he was unable to obtain his prescription medications. Medical diagnosis is congestive heart failure, or CHF. Medical treatment is 40 milligrams Lasix by mouth daily and 12.5 milligrams metoprolol by mouth daily. Nursing diagnoses include activity intolerance related to shortness of breath, weakness, and fatigue, excess fluid volume related to impaired excretion of sodium and water, and decreased cardiac output related to impaired cardiac function. Some key nursing interventions would be administer supplemental oxygen to relieve shortness of breath due to ischemia, assess vital signs urine output, auscultate heart and lungs, prior to administering medications, assess blood pressure, heart rate, and rhythm, educate patient on diuretic therapy to decrease preload and blood volume, and educate patient on beta blockers to decrease workload of heart. Lastly, assess learning needs and educate patient on signs and symptoms of worsening condition and when to seek medical attention. Critical patient information is readily accessible to clinicians of all disciplines with complete patient profile. Having a detailed patient profile can help clinicians make appropriate decisions, interventions, and a plan of care for the patient. So clinical judgment comparing self-capacity with chronic illness and treatment demands. So Mr. JC is a high level of self-care capacity. He's able to carry out activities of daily living without any assistance, and he's also able to care for his wife. He does have his 2 children close to him, so if he needs any extra help, they are readily available. So the patient is compliant with his medications, diet, and exercise. However, due to his unemployment, he lost his health insurance and was unable to obtain prescriptions, which resulted in an episode of exacerbation. Mr. JC is currently in process of obtaining his health insurance. He will definitely need a follow-up appointment with his primary care provider as well as his cardiologist after being discharged. He will understand medications and the side effects and comply with medication adherence. Even though he was previously before, we want to make sure that he continues to do so. We want to remind the patient to stay on a low sodium fluid restriction diet and encourage daily physical activity, at least 30 minutes a day, if not more. Also daily weight monitoring, and make sure the patient recognizes signs and symptoms of worsening condition and will seek medical attention if indicated. So improving knowledge of self-care is definitely vital to successfully reducing morbidity and mortality and health costs related to heart failure. Evidence-based practices are in place that incorporates from studies. Priority patient issues for discharge planning. So the patient didn't have too much issues with this. Just the main thing is lack of insurance for his prescriptions and insufficient funds for medication, as the patient is currently unemployed with no health insurance. Potential for ineffective coping related to disease process. So Mr. JC can be a little bit depressed from being in the hospital because he's usually very high functioning and feels very vulnerable while being in the hospital. Clinical judgment about where a patient can be discharged. So the patient is highly capable of providing self-care. He lives with the wife and his children are nearby, so if he needs any additional help, he can just call. He has access to transportation and can get around easily. The patient even drove himself to the emergency department when his symptoms of CHF exacerbated. He will need a case manager and social services involved to help with finances and obtaining proper health insurance prior to discharge. Follow-up care with his primary care provider and cardiologist are necessary. A review of medications and teaching, education, and the patient will be able to be safely discharged back home as he is high functioning. So next is priority NCM strategy at patient level and system level. So at patient level, Mr. JC insisted that he would stay on track with his condition. He felt very vulnerable in the hospital and never wanted to come back again. So he says that he will continue with a low sodium cardiac diet and fluid restriction, which will allow the patient to establish healthy routine. Mr. JC will also continue on with his daily exercise once he's discharged. This will get the patient back to his baseline before he was laid off from his health insurance, before he was laid off and his health insurance was taken away, leaving him with no prescriptions. So system level, the case management will make sure that the patient's discharged with health insurance so that he can pick up his prescriptions at no cost, and he won't have to worry about paying for them. Classes will also be provided if he feels at any time he needs additional support or further education to maintain his compliance to his regime. Interventions for the patient level NCM strategy. So health promotion concept can be applied to this case study according to Lubkin's Chronic Illness Impact and Intervention book. Health promotion involves individual behavioral change and environmental support. Nurses, as well as family members, should be actively involved in the patient interventions to promote patient self-care management. This is extremely crucial. The patient or the nurse should also actively listen to the patient's concerns and needs. Educate the patient on the importance of always having health insurance and provide resources if the patient's ever in the same situation again. He knows who to contact immediately so he can get his health insurance back. Always involve patient's family members in education of the chronic illness. So when the patient goes home, family can also help him stay on track with his disease. Provide ongoing assessment to determine compliance, support, and education. So intervention for the system level strategy, according to Nicholas, monitoring of patients with chronic heart failure requires cognition that disease management programs for such patients need to be multi-facilitated with intensive patient education, optimization of therapeutic regime, and ongoing surveillance. So health insurance must be obtained prior to discharge. This is just the main concern for Mr. JC. We want to make sure that the patient's able to obtain his prescriptions and understands how to take him prior to discharge. It's important to arrange an appointment with his primary care provider and a cardiologist for follow-up appointments. And we want to locate resources in the community and support groups if the patient wants to have additional assistance with his chronic condition. So like books, educational packets, pamphlets, videos, CDs, web pages, and computer programs are used in educational health strategies to increase the patient's understanding, in addition to offering opportunities to implement follow-up by phone or support group, because the volume of information provided at the discharge time is very large. So all the information Mr. JC may not be able to retain because it's so much, so he could have additional support outside as outpatient. So utilization review is a safeguard against unnecessary and inappropriate medical care. It allows healthcare providers to review patient care from perspectives of medical necessity, quality of care, appropriateness of decision-making, place of service, and length of hospital stay. So for Mr. JC, the UR nurse would assess and review, obviously, his imaging, lab tests, telemetry monitoring, IV medications like Lasix, respiratory nutrition services, and the length of stay. We want to make sure that the doctors are communicating with each other and not ordering, double chest x-rays or lab tests that are unnecessary for the patient. So this is important to review as it helps to decrease costs and improve overall care. Quality and safety issues. So core measures, congestive heart failure, very, very important that the nurse follows those guidelines. We want to ensure patients' history is accurately taken, like allergies, past and present medical history, all home medications. We want to ensure that medication safety in regards to correct dosing per doctor's orders. We want to ensure patient is able to self-monitor all his symptoms of congestive heart failure and ensure that nursing procedures were accurately performed according to standard protocols, like I mentioned with the core measures. We want to ensure a safe transition from home to hospital and ensure proper documentation to support core measures were fully met. So according to the Heart Failure Society of America, they recognize the importance of health education, recommend that patients receive educational materials at the time of discharge. In addition, the Joint Commission also recommends that heart failure patients should receive written instructions at the time of discharge based on directives and guidelines, which therefore goes back to the core measures of congestive heart failure. So NCM effectiveness at the patient level. So Mr. JC did receive Medicare health insurance due to his age, anyone above the age of 65. He returned to participating in healthy behavior, like adhering to a cardiac or low sodium diet, and he walks with his wife at least 45 minutes a day. He also joined a fitness center and attends exercise classes 3 times per week. He learned the importance of medication and incorporates alternative therapies and complementary therapies like yoga and acupuncture, which he indicated really helped. He participates in volunteers in educating his local community center on how to deal with heart failure as a chronic illness, since he is able to deal with it so well after getting his health insurance. He also documents and logs in his phone his daily weight and fluid intake per day and monitors his urine output. So if there's any changes, he can contact his doctor right away. So NCM effectiveness at a system level. NCM determined that patient was stable and safe enough to drive home in his own automobile after being discharged from the hospital. He did not need any other means of transportation besides his own car, like he did not need a taxi or an ambulance because he was stable enough to go home. Due to the patient's age, he was able to receive Medicare, and his hospital finances were covered along with his prescription medications. Also, they covered for a scale so the patient could weigh himself at home every day. Referrals to the cardiologist have been performed for routine yearly assessments and provide the patient with contact information and phone numbers in case of any questions in regards to his health. So any changes in symptoms, any questions that he has about medications, he has a phone number that can be called right away and answered. This is my reference page, and thank you guys all for listening. Hope you enjoy.